Good morning and welcome to the 13th meeting of the COVID-19 Committee. We have apologies for the meeting this morning from Annabel Ewing, Fiona Robson and Willard Coffey, who are attending other parliamentary committees. Ruth Maguire joins us as a substitute for Annabel Ewing, Alistair Allen joins us as a substitute for Fiona Robson, and Clare Adamson joins us as a substitute for Willard Coffey. I'd like to welcome Ruth, Alistair and Clare to the meeting. And we're also joined by Liam Kerr as an additional member. Can I start by asking the substitutes if they would declare any registrable interests relevant to the committee's remit? I'll start with Ruth Maguire, please.
No interest.
Thank you, Ruth. Alistair Allen, do you have any registrable interest? Clare?
Nothing specific, but would obviously refer people to my register of interests.
Okay, thank you. And Clare, do you have any registrable interests you wish to?
No interest to declare, thank you, Convener.
Thank you very much. Okay, we'll now turn to the substantive business on the agenda. And with this morning, we're dealing with a number of statutory instruments. For our first evidence session this morning, we are joined by Jeane Freeman, Cabinet Secretary for Health and Sport, who will give evidence on the health protection coronavirus restrictions Aberdeen City Regulations 2020, SSI 2020/234. And the Cabinet Secretary is joined this morning by officials, Paul Cackett, who's Director of the Scottish Government's Outbreak Management, and Luke McBratney, who's the Lead for Transition, Constitution and Rights. I welcome you all to the meeting, and I invite you, Cabinet Secretary, to make an opening statement.
You and to colleagues. I want to start my short opening statement by paying tribute to the extraordinary hard work on the ground that is being undertaken in Aberdeen City to bring the outbreak there under control. The drive and rigour with which the local incident management team, NHS Grampian and Aberdeen City Council have led this work has been exceptional, and in particular the contact tracing, which has led to 1,141 contacts being identified, traced, contacted and given advice, has been recognised by everyone as world-class. These measures are working. They are bringing the outbreak, by far the most serious local outbreak in Scotland since lockdown began, under control. But while there are positive indicators, the activity rate per 100,000 amongst cluster cases is 37.2, and amongst cases not related to the original cluster, it is still over 20 at 22.7. This is high. The rate across the rest of Scotland is 6 per 100,000. And our testing and tracing is still reporting a significant number of new infections that are not connected to the pubs and nightlife cluster. That means that we cannot be sure that community transmission is not taking place. Our clinical advice from the Chief Medical Officer and from Public Health Scotland is that we cannot presently say that this outbreak is sufficiently under control. We cannot describe the risk in relation to community transmission as acceptable. For these reasons, it was the judgment of ministers that we cannot immediately lift the restrictions in Aberdeen City. To be clear, the local incident management team did not argue for an immediate lifting of these restrictions from the 19th of August, neither did Aberdeen City. What both wished for was that non-licensing premises could be opened from this weekend. What we all agreed is that we are now looking forward to lifting these restrictions and to doing so in a deliberate, phased and cautious way. We take account of all the views that are expressed to us and recognise that these are difficult decisions and that the leadership of Aberdeen City Council and others have been and must continue to be involved in the decision-making process. From what we know about the disease, it's important to be able to analyse the cumulative impact of restrictions after around the 2-week mark to properly understand the extent of progress and how sustainable that is. We are getting detailed daily information on the outbreak. Yesterday marked 2 weeks on restrictions in Aberdeen. For that reason, we've suggested a further meeting with clinicians, counsellors and officials on Sunday to review progress. And whilst I can't preempt that discussion, because we will need to look at the data that is before us at that point, including the daily data up to that point, I can tell the committee that, dependent on progress, the sort of measures we expect to consider include permitting hospitality without the serving of alcohol from next Wednesday, and the publication of a clear route map for the lifting of the remaining restrictions beyond that. Of course, we recognise the impact this has on businesses in the area, but the impact of an outbreak going out of control in Aberdeen and across the North East would be much more severe, both for business and for public health. So we are providing additional support to business in Aberdeen of a £1 million package that was announced yesterday. Commissioner, I think we are taking a measured, proportionate and responsible approach. It's consistent with that being taken to the suppression of the disease across Scotland. The overall objective that government and local council have is a shared one, which is to get the restrictions lifted as soon as possible. But we must not do anything that jeopardises the significant progress, hard won, that has been made so far. And as with all the decisions that we make during this pandemic, we are informed by the evidence and then we take the necessary judgments. Thank you very much.
Thank you, Cabinet Secretary. We'll move on to questions. Can I just say to you and your officials, firstly, bear in mind there's a slight lag in the broadcasting, so just take a breath before you answer a question to allow the broadcasting to switch the mics on. And secondly, if you wish to bring in any officials at any point, I think it'd be helpful if you indicate that verbally, first of all, to the broadcasting team. And again, if your officials can just pause for a moment before they speak, that will allow broadcasting to switch the mics on so we don't miss the first few words of what is being said. Can I just start off then and ask you about the issue you just alluded to, which is the announcement yesterday that the restrictions will be extended for a further period. There obviously has been a lot of commentary around this. You have seen some of the reaction there's been locally, has been reported in the media since yesterday, concerns from the Chamber of Commerce in Aberdeen about the extension in the restrictions. How does the Scottish Government weigh up the different issues here in terms of the short-term health risks from COVID and the longer-term health risks from extended restrictions, and also the economic risk from extended restrictions? How does that equation work?
So thanks very much, Convener. I wish I could give you almost a simple mathematical equation for that answer. Unfortunately, no such thing exists. And in every instance of an outbreak, we have to be able to take different kinds of decisions depending on the nature of the outbreak, how it has started, how it is spreading, the geographical area it's in, what the evidence is telling us from contact tracing, but also what the evidence is telling us about the 7-day rate of cases per 100,000. We take all of that into account together with the clinical advice and the views. Of course, the IMT is a gathering together of more than one area of expertise who are on the ground locally and therefore have a very particular perspective to contribute that is really important. And so looking at all of that and taking then the assessment from our Chief Medical Officer, our National Clinical Director, of what they are seeing in terms of that data, a judgment then has to be made. Where I think I would gently take dispute with what you said, I wouldn't characterise the health risk from this virus as short term. I think the health risk from COVID-19 is very serious indeed, potentially life-threatening. We have seen that, and it also produces long-term health impacts, which we are only now learning about globally and will continue to learn about. So that is a very serious risk that we have to pay really close attention to. So what we are trying to do, as you know, is reduce the level of the virus in Scotland to the lowest possible status. And in doing that, then keep it there. As we ease restrictions, inevitably, because people are out and about more, because the virus hasn't gone away, its incidence will increase. That is where outbreak management, test and protect, those local IMT-led exercises becomes very critical to us. How they are doing allows us to then take a judgment about whether restrictions can be lifted in any particular instance. But as I said in my statement, it takes about 2 weeks, and we know this from imposing lockdown restrictions earlier on. It takes about 2 weeks for you to see whether what you've done has had an impact on the incidence and prevalence of the virus in any particular community. So at the end of the day, the data's there, everyone can see it, but the judgments that are made have to take all of those factors into account. And none of them, and I know you wouldn't question this, but none of them are taken lightly, and they will differ, as they have done so far, from outbreak to outbreak in terms of what we do.
Okay, thank you, Cabinet Secretary, for that response. It's very helpful. You alluded to in your opening statement the views of the City Council in Aberdeen, and you also referenced the fact that both they and the local incident management team were recommending a greater relaxation of restrictions than you've actually proposed here. Why do you think that you and your team in Edinburgh are better placed to make decisions about what's happening in Aberdeen than those who are on the ground, including the health professionals in that team?
Well, to be fair, I think that's a slight mischaracterisation, if I may. To be fair, the incident management team argued that on balance, they believed that it could be possible to open non-alcohol related hospitality from this weekend. And that was also the City Council's position. Our view, given what I have said about the rate per 100,000, not only in the cluster cases, but also in the other cases not related to the cluster. So that's an area of concern. It's not just the cluster around nighttime hospitality we're seeing, it's also other cases not directly linked back to those. Given that, the judgment we took was that that was too soon, but taking account of the views of the IMT and the Council, we said, let's meet again and consider this on Sunday to see if it is possible, if all the figures keep going in the relatively positive direction they have gone so far, if it is possible on Sunday, and I can't preempt that, to say that from next Wednesday, non-alcohol hospitality could reopen, and a clear route map for the easing and lifting of all the other restrictions can be set out so that people know what they are working to, because we appreciate that the situation of going from 1 week to the next and not knowing, am I going to be able to open this week or not, simply adds to the difficulty that we completely accept those businesses and others are experiencing. I know that in my portfolio in terms of our care homes, because we have not permitted care homes in Aberdeen City to extend their visiting for residents to the degree we've permitted it elsewhere. And that is a serious situation and a real difficulty for families and residents. Equally, hospital visiting has not been extended either. So I completely understand the concern, the impact of our decisions, but the balance is that our strong view that to lift any of the restrictions now is too great a risk at this point, because we still have to see a few more days of positive data coming through, hopefully bringing down those rates per 100,000.
Okay, thank you, Cabinet Secretary. I know other members will want to come in and some of these issues a little bit more. I'm now going to move on to Monica Lennon, please, and after Monica, Stewart Stevenson.
Thank you, Convener. Good morning, Cabinet Secretary. Just for clarity, because the Convener's right, there's been a lot of commentary in the last couple of days, and certainly there's been local reaction from authorities and from people living in Aberdeen City and obviously the wider Grampian area. Can I just ask Cabinet Secretary, is there a disagreement between the Scottish Government and the local partners, incident management team? Has there been a row? And if that's not the case, why does that appear to be so? Because I think we would all agree that that's not great for public confidence, because people need to have confidence in the data that they hear about and they read about, and they need to know that everyone's working together. So can you just unpick some of that and tell us really what's been going on, and are people going to get round the table quickly and try and sort it out, Cabinet Secretary?
So, thanks very much. I think it's a really important question from Ms. Lennon. I don't believe, and having been in the discussion myself, I did not witness or hear a row. What I heard was a view expressed, as I've now reported it, from the IMT and from the City Council, that they believed it was possible, on the basis of what the data they were looking at, as the same data we were looking at, to open non-alcohol related hospitality from this weekend. That was not a judgment that we shared. And it is a judgment. It's not as I said to Convener, it's not a binary position that you can get into here in any of these outbreaks. It is a range of factors that you take into account. And I know Ms. Lennon understands that. I would not characterise that as a row. I would characterise that as entirely legitimate, that you can look at the same information and reach a different judgment. But recognising that that was different, that was why we also collectively took the decision that we would reconvene probably on Sunday, looking then at the data before us, which covers a number of days, obviously, since the beginning of the week, hoping to see the continuation of a reduction in the numbers of cases, continuation of the real success of Test and Protect, and a reduction, steady reduction in terms of the rates per 100,000, particularly in the non-cluster related cases. So the ones that are not directly related to the nighttime hospitality, where we have a degree of confidence we have captured all of those. And so we would meet on Sunday, and we hope that that was a compromise position, if you like, between those two judgments that would allow us, I hope, on Sunday, if we've seen the right progress, to be able to say non-alcohol related hospitality can open from Wednesday, and here is the route for all the other restrictions to be lifted, and the outline time frame for that. Now, I can't preempt where we will be on Sunday, but that is the intention, and that is trying to ensure that particularly people in Aberdeen City have increased clarity about what they can expect and when they can expect it.
Say that the government will publish the
Please.
Sorry, I can't hear you, Convener.
Sorry, Monica. You started talking. We missed what you were saying, but your mic wasn't on. Can you just start again, please?
Sure. It appears to be on, so I will continue. Thank you, Cabinet Secretary. That's helpful, and in the interest of transparency, will the Scottish Government publish the recommendations that came from the incident management team? But if I can ask just one further question, Convener, depending what happens on Sunday, if the restrictions are to continue, if that's what Government's minded to do, clearly there is a dip in confidence. We've heard that even on the radio this morning from the business community, from employers in Aberdeen City. So will the Government commit to providing further support to those employers, to those sectors who feel that they are perhaps at a crisis point, and should provide an update on that, please?
So, as I'm sure Ms Lennon understands, that area of government is not in my portfolio, but I do know that Ms Hislop and her officials have engaged consistently with the business community in Aberdeen City. That additional £1 million, which is additional support, has been provided, and I know that Ms Hislop will be open to any further discussions that the business community want to have with her. We will see where we get to over the course of the coming days.
Okay, thank you, Monica. I'll move on to Stewart Stevenson, please, and after him will be Beatrice Wishart.
Thank you, Convener. First of all, Cabinet Secretary, can I welcome the indication that will be an interim review meeting on Sunday. I'm sure that in Aberdeen there will be customers who will want to use the facilities that are in prospect for reopening. But in Aberdeenshire, which constitutes the overwhelming majority of my constituency, the people I've been meeting are extremely cautious and simply won't return to businesses in Aberdeen until they assess that the infection risk has come down. So what I want to ask Cabinet Secretary is, how are you considering the impact on the general public of the numbers that you've given, the 37.2 per 100,000, which compares with 6 in the whole of Scotland, showing that we still have elevated levels of infection in Aberdeen? My constituents are extremely cautious about that, and even if everything opens up next week, I don't think a flood of them will be going there. Is there a danger from that disconnect between actions that we have to take, taking the balance between commercial needs and health needs, but the wider view in the community that they are more cautious? If the government gets ahead of the community, is there a danger that damages confidence in the government's overall messages that and those that are coming from health professionals? Thank you.
Well, I think Mr. Stevenson is right in general terms, in as much as if any government gets ahead of where a community is, then that is not the right place for a government to be. Equally, for a government to be lagging behind where a community is equally not the right place for a government to be. The way in which we try to lead in this area is to set out the issues that we're looking at, the balance that we're trying to strike, recognise absolutely that these decisions can be hard to throw for those on the receiving end of them, and that they are difficult to make, but our rationale for making them and our intention in trying to suppress the virus overall. The public will hear that and will reach their own judgment about whether they think what we are doing as government makes sense to them or not. And we are very mindful, and have been from the outset here, of the situation in Aberdeenshire and indeed in Moray, and taking a careful eye to ensure that we don't see spread in any significant way into either of those two geographical areas surrounding the city. And that, of course, was part of the reason for the 5 mile restriction, asking people not to travel more than 5 miles for leisure purposes. Obviously, work and education is a different matter. So to limit the travel restriction, but not to overimpose into a travel restriction. So we're very mindful of the to and fro from the surrounding geographies to a city, and Aberdeen City in this particular instance, and trying to ensure that the situation in the city that we are trying to control does not spread exponentially outside and therefore affect residents elsewhere as well.
Thank you, Stewart. We will move on to Beatrice Wishart, please, and after Beatrice, it will be Alistair Cullen.
I think that's the sound on now.
Yes, we can hear you now, Beatrice. Carry on, please.
Thank you, Convener, and good morning, Cabinet Secretary. I'd like to ask where students feature in the government's plans about local lockdowns. The student population we know will be making moves to return or arrive perhaps for the first time in Aberdeen, including many from Shetland. So how will local lockdown measures take account of this?
Thank you very much, Ms Wishart, and good morning to you too. It is a really important question. We're very conscious that shortly significant numbers of students will arrive across Scotland from other parts of Scotland, from the rest of the UK, from Europe and much wider. And so with Deputy First Minister, who of course is in the lead here with Mr Lockhart, my officials and I are also working with University Scotland on an overall plan in terms of the restart of higher and further education, which also looks at testing, looks at how we can support those students coming from countries where they will be required to quarantine, and what more, together with the University of Scotland, the individual universities and the colleges, we can do, both to provide students with persistent, accurate information about what we require of them, regardless of where they've come from and what we need them to do, but also where they can get help and support through their university or their college. In terms of individual lockdown restrictions that may apply in any area in Scotland at any point, all those living in that area will be expected to comply, and that will apply to students. So if we get to a stage, we may not do, but if we did, where the universities and colleges in Aberdeen City were restarting, and as much as their student population was arriving, any restrictions there, we would be working with the universities and colleges to make sure that they were giving their students accurate information about what they were expected to do as people living alongside the citizens of that city. So that's how we would undertake that work, and we are working very hard, knowing that students across Scotland are imminent arrivals.
Thank you, that's a very helpful response. Could I ask, my final question is around other council areas being informed of the lockdown of Aberdeen City. We've already referenced Aberdeenshire and Murray, but in terms of the Northern Isles, for example, we know that Aberdeen is very much Shetland's lifeline hub. So were other councils cited on plans beforehand? And I would just also like to reference that in terms of patients who go to Aberdeen hospitals, I'm aware anecdotally that some have cancelled appointments that they had in Aberdeen. So I wondered if the Cabinet Secretary could comment on that, please.
My apologies, Ms Wishart, I can't confirm for sure, but I will check this. what information was sent to other local authority areas in respect to the decisions made around Aberdeen City. Obviously, Aberdeenshire Council was engaged in the discussions, but wider than that, I can't absolutely confirm that with certainty, and I'd rather be sure. So I will double check that and make sure that you know. It's a very important point to make sure that, to remember the interrelationships between our different local authorities, more importantly, the people who live in those areas, moving from one local authority area to another for work or family or other purposes. I have not had any information that patients from Shetland or the Orkneys had cancelled appointments. There was no reason to think that the hospitals in the city were any less safe than because of the restrictions. The measures taken in those hospital settings are as comprehensive and effective as anywhere else. But again, I will speak with NHS Grampian and make sure, and actually with all our boards, because we do not know that we might face this situation or a comparable situation elsewhere at some point, with all our boards, to make sure that they are giving good information to patients that is accurate, but also, where it needs to be, reassuring to them.
Thank you.
Thank you, Beatrice. I'll now call Alistair Allen, and after Alistair will be Adam Tomkins.
Thank you, Convener, Cabinet Secretary. Obviously, there'll be interest in how the rules work in Aberdeen should, and we hope they don't need to be operated elsewhere in future. So can I ask for a view, please, as to how you feel the rules around those premises who defy the rules will operate, thinking particularly of fixed penalties, and just some assessment from you about how you feel that will work and whether you feel it is workable.
Thank you very much. Of course, you know that we have moved some of what was in guidance into a more statutory position in terms of hospitality, particularly around contact tracing. Contact tracing and taking of contacts in restaurants and bars is really important, as is preventing standing at bars and queuing that isn't 2 metre distance queuing. So those are really important matters, and many premises across Scotland have complied with those from the outset, some less so. And so we need to be able to assist them to comply. And I know that Police Scotland will take, as they have said they will, the approach they've taken throughout the pandemic, and that is to inform and encourage, but if necessary, to enforce. I also know that Aberdeen City Council, through their environmental health, has put and is planning to put a very great deal of effort in contacting businesses to ensure that they completely understand what the guidance is and the expectations of them, and then checking that those are being complied with. And that is a very helpful exercise that the Council is undertaking, as they would do given their responsibilities in terms of environmental health.
So what are the options in terms of penalties for those premises who operate in defiance of the rules?
So are you meaning the amounts, or?
What are the deterrents? What are the options for intervention should anyone operate an establishment?
Operating an establishment that does not comply with what we require of them. I have both Paul Coquette and Luke with me on the line, and they will be able, I hope, to give the accurate response to that question. If we could go to I think to Luke.
Dr. Allen, the contravening an obligation imposed on a business under the regulations is an offence, ultimately. The regulations, though, bolster that with a number of enforcement measures, including the ability for a notice to be issued requiring compliance with one of the obligations in the regulations, and, as you indicate, a fixed penalty notice regime. I think, as the Cabinet Secretary said, these are very much held in reserve. The principal method of enforcement is to try to achieve agreement and encouragement first, but ultimately contraventions of the health protection regulations are an offence.
Thank you, Convener.
Okay, thank you, Alistair. I'll now call Adam Tomkins, and after Adam, it'll be Clare Adamson.
Thank you, Convener. Good morning, everyone. Cabinet Secretary, the preamble to these regulations states that the Scottish ministers consider that the restrictions and requirements imposed in these regulations are proportionate to what they seek to achieve. Can you explain to me what you understand by proportionate, please?
Thank you very much, and good morning to you, Mr. Tomkins. In this instance, proportionate is restrictions that link back to where the outbreak occurred. Very clearly, the outbreak occurred in the hospitality sector, in the nighttime economy around bars and restaurants, and the regulations that we have brought forward to impose the restrictions that were agreed with the councils in the first instance are restrictions in order to limit the opportunity for the virus to be transmitted in those situations, and other restrictions that protect our care homes and our hospitals, add additional layer of protection, but also look to limit the opportunity of the virus to transmit from the city to the surrounding areas.
Thank you. But proportionate is not a term that we can choose to define howsoever we like. It's a matter of law, and in law, it means, doesn't it, that measures will be lawful only if they can be shown on the basis of evidence to be the least restrictive available means. That's what proportionality means. So a proportionate response is the least restrictive available means. So in order to understand whether these regulations meet or do not meet that test, we need to know what the intended outcome is. And the intended outcome has been perfectly clear right from the beginning of the coronavirus crisis. The intended outcome is to protect lives, or to save lives, and to protect the NHS. So can I ask, the BBC reported yesterday that there have been 226 confirmed cases of coronavirus associated with the Aberdeen cluster so far. Of those 226, can you tell us how many people have been hospitalised with COVID-19, and of those, how many are in intensive care?
There have also been 172 cases in Aberdeen not linked to that initial cluster. And as I said in my opening remarks and in response to one of the questions, they, together with the clusters linked to bars and leisure facilities, are of considerable concern and relate back to the cases per 100,000, which of course is a really important measure of the level of risk. In terms of individuals in hospital or intensive care, my understanding is that none of those cases have been in intensive care. We will double check, but I don't believe that any either have been admitted to hospital. Of course, as we know, and as I'm sure Mr. Tomkins is aware, the measure of seriousness of the impact of the virus, should you contract it, is not simply whether or not you are hospitalised or end in intensive care, but also the harm to your health. And emerging evidence is really clear about the long-term harm to health both respiratory and cardiovascular, to those individuals otherwise healthy before they contracted the virus, who now are experiencing significant health problems, leading to them continuing to be very unwell, notwithstanding additional, in some instances, psychological problems. So the measurement, which is around hospitalisation and intensive care, an attempt to judge the seriousness solely on that, is, I would argue, flawed.
Very grateful to the Cabinet Secretary for that answer, and I don't disagree with the remarks that she made about the extreme seriousness potentially of this disease. But our job as lawmakers is to ensure that the law that this Parliament makes is proportionate and indeed lawful. And given that the ambition of these regulations is to save lives and protect the NHS, and that is an ambition which we all equally share right across the political spectrum. And given that, as you just said, there are very few hospitalizations and no incidences at the moment of COVID patients being in intensive care in relation to the Aberdeen cluster, it is very difficult to understand what the evidence is that justifies a partial lockdown of a city of 228,000 people. And that's our job. It's our job to try and understand what measures are necessary to be taken and to ensure that the measures which are being taken are the least restrictive available means. So, Cabinet Secretary, given all of that, what is the evidence that the measures in these regulations are the least available restrictive means? Because if you can't provide us with that evidence, then these regulations are prima facie unlawful.
So let me do my best, Mr. Tomkins. I don't disagree with you that part of our overall objective, of course, is to save lives and protect the NHS. That has been the case since the outset. But linked to that, and in fact central to doing that, is the shared ambition across the 4 nations of the United Kingdom to suppress the level of the virus in the community to the lowest possible level. So you don't just look at what you are required to do and whether it is proportionate solely on the basis of what numbers have gone into hospital and how many people are in ICU. You look at what is the prevalence of the virus in this particular community. That could be a city, it could be another defined community, a town or whatever it might be. What is the prevalence of that? And is it too high? Is it rising? Is it coming down but not fast enough? How does it compare to the rest of the country? Because if it is much higher than the rest of the country, then the risk is, if you don't contain it and control it in the geography where it is, it will spread. Because I know you know, as others in the committee do, just how easily this virus spreads. Given half a chance, it jumps from one person to another with considerable impact and effect. So the numbers that I gave at the outset, and this is the point in relation to some other questions I've been asked and my comment to the convener about how I wish there was a straight mathematical equation. There isn't. There's a number of factors. Case numbers, absolutely. Hospitalisation, ICU, absolutely. But so too is the 7-day rate per 100,000. And what we have in the cluster cases in Aberdeen City is a 7-day rate of 37.2 per 100,000. In the non-cluster cases, a 7-day rate of 22.7 per 100,000. Both of those higher than the numbers we look at before we take decisions about whether or not incoming travellers from any other part of the globe should be required to quarantine or not. And the Scottish figure, the overall Scottish figure per 100,000 is 6. So I hope you can see that what we are trying to do with these restrictions is prevent the spread of this virus beyond Aberdeen City and control it and close it down in Aberdeen City. And that is why the restrictions that have been put in place, the range of restrictions that, yes, have had a very serious impact on business in the area, but they've also had a serious impact on care home residents and families, on patients in hospital and families who cannot visit them, on travel, on a range of other activities that citizens would want to be able to pursue quite rightly. But they are, in my view, necessary in order to prevent a significant and complex outbreak in Aberdeen that clearly is now producing non-cluster cases, to prevent that spreading beyond the city boundaries. Progress is being made and it is significant, but in our judgment, not yet sufficient for long enough to allow us to lift any of those restrictions today, but we will review the matters on Sunday.
Okay, Mr. Tomkins, I take it that's your questions through, in which case I have two supplementaries on this. I'll start with Ross Greer, please.
Thank you, Convener. Cabinet Secretary, I realise I'm about to ask what sounds like a simple question that definitely doesn't have a simple answer, but bear with me. On the point that Mr. Tomkins raised of proportionality and the selection of the least restrictive measures that achieve the intended outcome, you've touched on this a little bit already, but would you be able to briefly summarise which measures that are less restrictive than the ones you've chosen were considered and discounted, and why they were discounted, why the decision was taken that those less restrictive measures would not have achieved the outcome that we are all looking for?
Thank you very much, Mr. Greer. I'm getting used to your simple questions that are never as simple as they sound. So we considered whether or not we should restrict hospitality, bars and restaurants only in the evenings. We considered whether or not we needed to have a 5-mile restriction for leisure purposes. We did not consider an alternative with respect to care homes or hospitals, because we believed that there wasn't an alternative restriction or limitation that we could put there that would protect essentially more vulnerable citizens. But we took the view that we had to act quickly and decisively in order to try to lock down the opportunities of the virus transmitting itself, and therefore the restrictions should be to the degree that they are. Now, what we, as you know, as I said earlier, the IMT looked at was whether or not, and in their view, they believed it could be possible to lift non-alcohol related hospitality restrictions from this weekend. That was not a judgment on balance that we shared, but that will be part of what is looked at on Sunday when we come together again to look at what has happened with the data in the period since we last met up to this weekend.
Okay, thank you. Stewart Stevenson, please.
Thank you, Convener. Cabinet Secretary Adam Tomkins appeared to argue against there being any restrictions in Aberdeen at all, where we are facing 37.2 per 100,000 7-day rate against Scotland's 6. As a person who's for 156 days now essentially been isolated from most of the local community and other community, I want to see that at 6, and any measure that gets us to 6 is one I want to support. But the fundamental question, reductio ad absurdum perhaps, is if we do nothing, will the figure in Aberdeen come from 37.2 down to 6? Because if the answer is doing nothing won't achieve that, then it is proportionate that there be restrictions in Aberdeen. Is that a fair statement of affairs, Cabinet Secretary?
So I think Mr. Stevenson raises a really important central point, but before I get to it, he raises another, which is the importance of everything that we do to protect those who are most at risk from the virus, which is obviously those 180,000 people who we have advised it is safe to no longer shield and to begin to pick up aspects of their lives that others of us have enjoyed for longer. And I know that very many of that number remain hesitant about that and anxious about how safe their communities are. And in terms of Aberdeen City, then their community is not as safe as it should be. Not only from the 37.2 per 100,000 cluster cases, but importantly from the 22.7 per 100,000 cluster cases. And remember too that one of our, I'm certain, shared objectives across all the parties in the Parliament is not only to open our schools safely so that young people can return to the really important area of their education, but to maintain the safe opening of those schools. So all of those factors are factors that need to be borne in mind. And I am firmly of the view that if we do nothing, if we lift all of the restrictions at this point, then we will not see the transmission of the virus in Aberdeen City controlled, contained and ended in this incident, and we seriously risk a significant spread of that virus to other parts of the geography surrounding the city.
Okay, thank you. We'll move on to Clare Adamson, please, and after Clare, I'll bring in Liam Kerr.
Thank you, Convener. Good morning, Cabinet Secretary. I was very interested in your evidence today, which of course will form part of my decision about how I support what's happening or not today. But you mentioned quite significantly the hard work of the teams that have been involved and the success of the Test and Protect. And to my mind, the fact that we haven't had any deaths or admissions into intensive care, it shows that work has been effective and that we have protected our citizens by the actions that have been taken by the government. So I was pleased to hear that, but you made 3 commitments. The meeting on Sunday with partners to move ahead, the £1 million package, which you've said, further detail will come from Ms Hislop, and I would welcome that. And you also mentioned the route map, and I would really like to know a little bit more about the route map, because we have a route map for the general public at the moment, and just to ask if this route map will be of a similar type, or will it have much more specific detail on it for particular areas in the economy. And given that schools are opening, and as my colleague Beatrice has said, that the universities and colleges are starting to welcome students into Aberdeen, I think it's really important that we recognise the pinch points that might pose in suppressing the virus in Scotland. So it's just to get a little bit of more detail about the route map.
Thanks very much, and I completely agree with you. I think the local IMT and the Test and Protect team have done a quite significant and fantastic job, and this has been and remains complex. It's the most complex outbreak we have dealt with so far, notwithstanding the situation that we were dealing with in Lanarkshire and then in Port Glasgow. This one is much more complex, and that's not just about the size of it, but it's about the nature of it. And I agree completely that they and the IMT, of course, includes the efforts of the local authority as a central part of that, and the health service, and they have done an excellent job in all of it and continue to do it. In terms of the route map, forgive me, it's not the route map that the First Minister will speak about today in Parliament. It is, if you like, can't think of another word for a route map. What we ideally want to do, and I do not know if this is possible, and we won't know that until we have seen the additional information that will come to us in the period between the decision that was taken not to lift restrictions at this point and the review, the further look that we will have on Sunday. But what we hope to be able to do at that point is, first of all, to say that non-alcohol related hospitality can open from next Wednesday, and that we will set out a time frame, if you like, whereby we believe that other restrictions can be lifted. It's not straightforward to do that, because what we can't do is say, if we get to this figure, that's what we can then make happen, because as you rightly say, Ms Adamson, there are a number of factors to take account of, not least the restarting of universities and the extra numbers, significant extra numbers of people who will be in the city from many different parts of the UK. So we will try to give those businesses for whom restrictions continue an indication of what they can plan for and what they can plan towards, as we have tried to do in the overall route map with indicative dates and so on. So we will try to do that, but what I'm saying now should not be taken as an indication that that is definitely what we will do, because I do not know at this point how possible and to what level of detail we will be able to set out.
Okay, Claire, thank you very much. And last on my list is Liam Kerr, please.
Thank you, Convener, and thank you to you and the committee for allowing me to come along to this committee this morning. Good morning, Cabinet Secretary. I have three questions on the information that you've referred to throughout as having informed this decision. First of all, what was the specific advice and providence received by the Scottish Government from the local team, which you and or the First Minister deemed insufficiently persuasive for a partial relaxation? And just referring back to Monica Lennon's question earlier, will you be publishing that data?
Okay, thank you very much. So all the IMTs currently handling outbreaks across Scotland at the moment meet a frequency they determine. They go through a number of areas, which is around case numbers, the rate per 100,000, the epidemiology, where they think the cases are linked, how they are doing on test and protect, and any other issues that they think are important for them to address in terms of whether or not they impact on their capacity to control the virus and prevent onward transmission. And some of that includes a consideration of the offers that we always make about whether or not they require additional resources in order to assist them. That may include additional mobile testing units or additional resource from the national provision in terms of contact tracing. So we're seeing that information on a regular basis, not simply when we come to consider whether or not, in this instance in Aberdeen, whether restrictions could be lifted in a whole or a partial sense at all. We're seeing that all the time. To that comes our health protection service, of course, is directly involved in that, and the directors of public health and other clinical leads locally will be involved in it. To that, we then have the senior level advice from the Chief Medical Officer and the National Clinical Director. And that is that and the actual data about number of cases, whether anyone has been hospitalised, how many contacts have been identified, have they all been traced, what has happened with those, are any symptomatic or tested, and so on and so forth. That is all the information that we are looking at. And when we come together in those discussions that will involve, as the most recent one did, and the one on Sunday will do, the local authority, we receive an update to that information if there is any further information we need to have. And of course, the local authority is hearing all of that too. So that is the, we're all, in a sense, we're all looking at the same information. But in this instance, we have reached a different judgment than the view that on balance was reached by the IMT and the view taken by the council. And the difference in that judgment is that both believed that it was, on balance, possible to open non-alcohol hospitality sector this weekend. And the view that the government took, the judgment we took, was that on balance, it was too early to do that. And I've set out all the reasons that led us to that, and in particular, the rate per 1,000 cases and the overall position that we're trying to achieve. So that is the information, and that is the basis on which government reached its view, having looked at all the information and took a different judgment. In terms of what is published and what is not published, I'm not aware of any particular protocol there may be in terms of how local IMTs operate. I'm happy to check that. In terms of the information that we are looking at as government, that doesn't come direct from the IMT, but does come in terms of those other numbers, we will, of course, we publish as much as we can publish that we are confident is robust and statistically sound. And I will check what the position is in local IMTs and whether or not they have a locus in determining the publication of their own material.
I'm very grateful, Cabinet Secretary. I mean, one would hope that it's all robust and statistically sound. So, yes, if you wouldn't mind checking out what can be published and letting me know, I'll be very grateful. There seems to be, second question, there seems to be a suggestion that 5,000 jobs might be lost as a result of the continuing restrictions. Can you help me understand what assessment was done? Was an assessment done prior to making this decision of the health implications, mental health, physical health implications of continuing the restrictions to this level, particularly if these job losses were to come to pass?
So there has been assessment. Again, I am the Health Secretary, not the Economy Secretary. I'm sure Ms Hislop would be very happy to answer the detail of that question in terms of the work that she and her officials have undertaken with the local community. But there was an assessment undertaken, and discussions, as I said earlier, have gone on for some time. We believed that 422 hospitality premises in the city would be affected by the restrictions. We took that from non-domestic rate data, but the City Council's view was that 600 businesses would be affected, and so it was the 600 number that we used to get to the additional financial package of support that has been put in place, and that Ms Hislop and her officials are now working through in order to make sure that financial support can get to those who need it. Of course, in everything that we are doing, in the overall route map, in the way we have set out how we will make these decisions, we talk about balancing the harms. There is the immediate health impact of COVID, which as Mr. Tomkins says, can and has taken lives. There are the other health harms caused by measures that we have taken to try and control and suppress this virus. There are non-health harms too, of course, and those are undoubtedly in the economic impact of lockdown itself, but also even as we ease the restrictions in terms of how the economy can recover from that. And we are very mindful indeed of the importance of balancing those, but suppressing the virus to the degree that we want to is intended not only to ensure that people do not become ill from this virus, and if they are particularly badly affected, hospitalised and potentially die, but because we also know that easing lockdown, virus growing exponentially, having to reimpose lockdown in a much more wider geography than a single city will itself be hugely additionally harmful to the economy. And that, I think, is a widely recognised assessment and is one that we hold to.
Thank you for that. I do understand the point you're making. I'll ask Mrs. Locke for that assessment, so thanks for that. Final question for me, if I may, Convener. In response, Cabinet Secretary, to a question from Stewart Stevenson earlier, you mentioned the 5-mile travel restriction. Now, I saw the Aberdeen and Grampian Chamber of Commerce describe the 5-mile restriction as inexplicable, was the word that they used. Can you point me, or what in your evidence that was used to kind of overrule the local can you provide to them that will make the 5-mile restriction explicable?
So it really is important to say that at the point when we included the 5-mile travel restriction for leisure purposes in the overall restrictions, neither the IMT or the City Council or Aberdeen Shire Council disagreed with that. And in the most recent discussion with those colleagues, none of them argued that we should lift that restriction. So clearly, all of those colleagues find that restriction explicable. It is explicable on the basis that we wanted to limit, without impacting unnecessarily or disproportionately on work or education, to encourage people to limit their travel into the city of Aberdeen and out of the city of Aberdeen. Just as we had that restriction in the very first outbreak we were dealing with around Gretna and Annan. That came, as you'll recall, I'm sure, at a point where we were lifting the 5-mile restriction for the whole of Scotland, but we retained it for those areas during the work we were undertaking to control that outbreak. And that is to try and prevent movement of people that isn't essential movement, because we do not want to give that opportunity for the virus to move with them.
Right, thank you, Mr. Kerr. Thank you, Cabinet Secretary. I don't see any other members want to come in to ask questions at this stage. In that case, we will move on to agenda item 2. And I'd invite the Cabinet Secretary to move motion S5M 22422 that the COVID-19 Committee recommends that the Health Protection Coronavirus Restrictions Aberdeen City Regulations 2020 SSI 2020-234 be approved. Cabinet Secretary.
Convener.
Thank you, Cabinet Secretary. Does any member wish to speak at this point in relation to this motion? I see Adam Tomkins.
Thank you, Convener. I think it's incredibly important that we understand just how draconian these powers and these regulations are. We all understand that draconian emergency powers are necessary to combat emergencies, whether they are emergencies caused by terrorism or war or natural disasters, or indeed emergencies caused by very serious public health problems such as coronavirus. But at the beginning of the coronavirus crisis, all 5 parties in the Scottish Parliament unanimously agreed that emergency powers could be tolerated only where they are shown by the evidence to be necessary. And we have probed the Cabinet Secretary in detail and at length this morning about the strict necessity of the measures contained in the regulations. We've asked her for evidence as to why they are in her judgment, and she has recognised that it is a question of judgment and not a question of science. Why in her judgment they are proportionate, why they are the least restrictive available means. And we know what the means are designed to achieve, and they're designed to achieve ends which we all share, irrespective of our other political differences. We all want to suppress the spread of the virus, we all want to protect the NHS, and we all want to save lives. But I'm afraid, Convener, that I am unpersuaded that the extraordinary powers in these regulations are the least available means available to the Cabinet Secretary, and for that reason, I will be unable to support these regulations.
Okay, thank you, Mr. Tomkins. See Stewart Stevenson, please.
Thank you, Convener. With a rate per 100,000 that is more than 6 times greater than the Scottish number in Aberdeenshire area, people's lives will be at risk if we do not pass this today. I cannot measure that risk. I can say, as someone over 70 years old, that I am likely to be personally affected by that risk, because if I'm affected, the results on an older age person are substantially more severe. All the evidence tells us that. So, for a personal reason, I won't entirely support this. But I urge Adam Tomkins to think again on this. It is proportionate to consider measures that will bring us down from a level per 100,000 6 times greater than the Scottish average, and no other way of doing this has emerged. That is why I should support this motion to pass this secondary instrument. Convener?
Thank you, Stewart. Ross Greer, please.
Thank you, Convener. The Cabinet Secretary's explained this morning why measures short of the ones proposed would not potentially achieve the outcome that we all want to achieve. And as Stewart Stevenson said, with an infection rate markedly higher than the rest of the country, clearly robust action is required, proportionate but robust. So the one observation that I would make is that the country in the world most often cited as having successfully dealt with this virus, New Zealand, has just gone back into a nationwide lockdown because of 9 positive cases in Auckland. They've taken the judgment and been correct so far throughout that short-term robust action is not only the best course of action for the long-term interests of public health, but also for their economy as well. So whilst I accept the really significant economic concerns, and I think we all should recognise that both the Scottish and UK governments will need to provide bespoke support, not just to Aberdeen, but to anywhere else that has to go into a localised lockdown, both through direct business support, extensions of the furlough scheme, etc. We should never see this as a choice between public health or the economy. The most robust measures to protect public health are the measures that protect our economy in the long term. So I'm content to support these measures.
Thank you, Mr. Greer. Just before I invite the Cabinet Secretary to respond, I would just comment personally that my concern around this is that we have a local incident management team, local health professionals who've taken a particular view on what should be done, and the Scottish Government has taken a different view. And my concern is that local opinion is being overridden by the Scottish Government at the centre, and that's why I'm myself nervous about supporting these regulations as they stand. But I will go to the Cabinet Secretary to respond, please.
Thank you very much, Convener. I think I have said a very great deal already as to why I think these measures are necessary. I would make 2 points if I can address myself to your concern. I understand that concern. I think that inevitably in situations where there are different judgments based on comparable information and indeed the same information, what we try to do is find a route through that. I think that we have tried that, and that route through it is not to wait another week before we look at whether or not we can lift any of the restrictions, but to look midway through the current week. Again, with Aberdeen City Council and other colleagues, including those leads from the local IMT and the health service and so on, to see if it is possible at that point, because the data emerges over the time, to take a different view from the one that was made public yesterday. I think that is us trying to work as much as we can with local opinion and view, and I understand absolutely those local concerns. So I hope that to a degree reassures you that we are not riding roughshod. We do not take this lightly. The role and importance of IMTs is critical to this, but that does not automatically mean that taking a national view, looking at a particular situation, we are always going to agree with every detail of the local perspective. My other point is really to agree very much with what Mr. Greer said. I think we should be very careful not to see public health and the economy is in some kind of battle with each other, that it's one or the other. They are inextricably linked. In normal times, a healthy, vibrant economy that offers equality of opportunity to all is an economy that contributes to good public health. Here, maintaining safe public health contributes absolutely to the potential we have to have that vibrant, growing economy. So the two do go hand in hand. And the balancing decisions, the judgments that have to be made between what we have described before as the range of harms is never easy. And absolutely, we have said before, I have no doubt, there will be times when we have not got it absolutely right. But in this instance, I think the figures speak for themselves. Without those robust measures, we would be looking at even greater infection levels in Aberdeen City than we are looking at now. The situation's improving, but not sufficiently so at this point for us to feel confident in lifting the restrictions today, but we will look again on Sunday, and these powers are necessary for us to be able to make that progress in partnership with our local colleagues.
Okay, thank you, Cabinet Secretary. I now need to put the question on the motion. The question is the motion S5M 22422 be agreed to. If any member disagrees, if they can type N in the chat box now. We do have a disagreement. In that case, there will be a vote. So can I ask all members, please, who agree to the motion to type Y into the chat bar now. Thank you. If any members disagree, can they type N into the chat bar now? And if any members are abstaining, can they type A into the chat bar now? I cannot, for some reason, use my chat bar at the moment, but I'm abstaining. Now we'll just take a second just to pause so we can verify that vote. Okay, the result of the vote is as follows. In favour of the motion were 7 votes: Clare Adamson, Ruth Maguire, Alistair Allen, Stewart Stevenson, Ross Greer, Beatrice Wishart and Monica Lennon. There were no votes against and there were 2 abstentions from Adam Tomkins and myself. and that motion is therefore agreed to. We'll now move on to agenda item 3, which relates to SSIs to which the Cabinet Secretary gave evidence to this committee at our meeting on the 28th of July. Our members contend for motions S5M 22238 and S5M 22299 to be moved en bloc. If any member is not content with that, can they please type N in the chat bar now. I take it members are content to do that, and I therefore invite the Minister to move both motion S5M 22238, that the committee recommends that the Social Care Staff Support Fund, Coronavirus Scotland Regulation 2020, SSI 2020/188 be approved, and secondly, motion S5M 22299, that the committee recommends that the Care Homes Emergency Intervention Orders, Coronavirus Scotland Regulations 2020, SSI 2020/201 be approved.
Convener, moved en bloc.
Thank you, Cabinet Secretary. Does any member wish to speak on these motions? I'm not seeing any indication from members who want to speak. I will therefore put the question on the motions. The question is that motions S5M 22238 and S5M 22299 be agreed to. Does any member disagree? If they disagree, can they please type N in the chat bar now? I don't see any disagreement, and therefore I will confirm that the committee has agreed to these two motions. Can I thank the Cabinet Secretary and her officials for attending the meeting this morning. The committee will publish a report to Parliament setting out our decision on the statutory instruments in the coming days. I now suspend the meeting briefly, just to allow a changeover of witnesses. Right, can I bring the meeting back to order, please, as we resume? For our second evidence session today, we are joined by Michael Russell, Cabinet Secretary for the Constitution, Europe and External Affairs in the Scottish Government, who will be giving evidence on the following regulations: the Health Protection Coronavirus Restrictions Scotland Amendment Number 9 Regulations 2020, SSI 2020/232, and the Health Protection Coronavirus Restrictions Scotland Amendment Number 10 Regulations 2020, SSI 2020/236. Mr. Russell is accompanied by two supporting officials, Luke McBratney, who is the lead for Transition, Constitution and Rights in the Scottish Government, and Rebecca White, who is Health Protection Coronavirus Restrictions Regulations Coordinator. Can I welcome you all to the meeting, and I would invite the Cabinet Secretary to make a short opening statement.
Thank you, Convener, and thank you for the invitation to come back, which I think is on the 8th occasion I've appeared in front of this committee. Today I want to discuss two further sets of amending regulations which amend the Health Protection Coronavirus Restrictions Scotland Regulation 2020, more commonly known as the Lockdown Regulations. On the 30th of July, the Scottish Government, which gave an indication of the order in which we will carefully and gradually seek to implement further changes in Phase 3 of that map. The First Minister announced the outcome of the 6th review of the restrictions and requirements set out in the principal regulations on the 30th of July. The outcome of that review and the assessment of the evidence was that it was not yet appropriate to move to Phase 4 of the route map in easing lockdown. A further review is taking place today, and the First Minister has already expressed caution about how we will proceed based on the most recent data, and she will of course say more about this in the Chamber within the next hour or so. The amending regulations to be discussed today give effect to aspects of Phase 3 of easing lockdown, but also strengthen the rules and mitigations we have in place to keep the virus under control. The Scottish Government made amending regulations by way of made affirmative procedure on the 31st of July and the 7th of August. These regulations entered into force on various different dates, and the plenary vote will take place in due course. The amending regulations make a number of adjustments to the principal regulations. They are to adjust areas where the decision to implement further aspects of Phase 3 necessitates a change to the restrictions on businesses and individuals. The regulations have allowed community centres to reopen and remove the legal requirement on schools to maintain physical distancing. The regulations also make provision for additional measures that are necessary to limit the spread of the virus. This includes extending the locations in which a face covering must be worn, and to give Scottish ministers a power to issue guidance on measures which should be taken in order to minimise the risk of the incidence and spread of the virus. As set out in the updated route map, there are some proposed changes to Phase 3 where we have not set or confirmed the date when they will come into force. Our expectation from the start of Phase 3 is that this phase may well last for considerably more than 3 weeks. We're already in week 6 of the phase. It's not yet clear when we will be able to step forward to Phase 4, but we are of course keeping that under regular review. The next review date for the regulations is today, and a further review is planned for the 10th of September. The First Minister will provide an update today, as I've said, and set out the findings of today's review, and I'm sure the committee will understand, frustrating as it will be, that it would not be appropriate for me to preempt anything that the First Minister might announce later today during the plenary session. I hope, Convener, that's been helpful. I'd be happy to take questions.
Thank you, Cabinet Secretary. And as ever, can I remind you, just when answering questions, just to pause and take a breath before you start speaking. And if at any point you wish to bring your officials in, if you just indicate that and give us their names and broadcast and can turn on their mics at the appropriate point. Can I start by asking a question around face coverings? You might recall at a previous committee session, Graham Simpson asked concerns about the number 7 regulations. And he stated at that time it was unclear in relation to where face masks are and are not required to be worn, particularly in relation to shops which contain a post office or facilities which involve money transfer. Now, I know the number 10 regulations do amend the principal regulations which previously applied to retail environments, with the effect that face coverings are now mandatory in a wider range of public spaces, including places of worship, crematoriums, community centres, post offices, takeaways, banks and other financial institutions. Can you confirm if you're expecting any further amendments around the wearing of face coverage?
Well, there are no amendments planned at the present moment, but Mr. Simpson did raise a number of points which are also clarified by these regulations. I wonder if I might ask Rebecca White to talk specifically about banks and post offices. As you're right to say, the regulations define quite clearly where face covering should be worn. They include a whole range of places which you perhaps haven't thought of, like aquariums, indoor zoos, visitor farms, but they do include banks, building societies and credit unions, and that was an issue previously where there was a difference between the regulations north and south of the border. But perhaps Rebecca White might like to say a word or two about banks and about post offices, because that does indicate, I know, the detail that we have to go into, and also the process of negotiation with stakeholders that's often involved in these matters.
Thank you. So on the issues that Mr. Simpson had raised at the last meeting, after that meeting, Mr. Russell wrote to Mr. Simpson setting out a bit more detail about the position at that point and explained that we were looking at whether any changes to that position would be appropriate. To give a little bit more background, when the restrictions on shops were initially developed, our policy colleagues engaged with the financial services sector around the possibility of face coverings in those settings, and there were some concerns at that point about the practicality of those measures in relation to security issues and to do with identification of people who were coming into the bank. Obviously, subsequently, UK government had done their own regulations, and they had concluded that the balance of evidence was such that face coverings should be worn in banks and financial services settings. So given that many of the businesses in that category operate both north and south of the border, this created, I think, some new evidence to think about the balance of restrictions. And so our policy colleagues went and engaged with the sector again, and concluded that actually the evidence that was emerging about the operation of this policy in other areas meant that it would be appropriate to make the change that we've got in these regulations here, which is to make face coverings mandatory in financial settings. And so hopefully that gives you a little bit more detail about the background to these amendments, and explains that engagement with the sector and learning from the experiences as face coverings policy is operationalised in different areas has helped to clarify where perhaps the balance of different factors actually indicates that face coverings should be worn.
Okay, thank you very much. I see Ross Greer wants to come in with a supplementary. Can I just ask one more question before I bring him in? I certainly had representation from constituents and those working in the retail sector saying they prefer wearing face visors to wearing face coverings. Can you just clarify what the regulations say about what a face covering needs to be?
And interestingly, there is very clear view on this now, and the regulations require you, if you're to wear a visor, also to wear a face mask. And SAGE discussed this on the 23rd of July, and they discussed the role of visors in the context of the role of aerosol transmission, which is the issue. And the SAGE group concluded that visors alone are inadequate protection, particularly for staff in close working sectors such as hairdressers, and advised that the guidance should be updated to include the wearing of face coverings. And indeed, if I can quote Jason Leach on this, because he was the one who made the point publicly, the scientific advice is that face shields do not provide adequate protection against small viral droplets, which can escape from the bottom of a face shield and land on surfaces or stay in the air for periods of time. They can provide some protection for the wearer against large droplet exposure, including, for example, splashing in a healthcare setting, but they're unlikely to provide any protection for the wearer against small aerosols. You can wear a face shield if you choose to, however, you must wear a face covering underneath.
Okay, thank you. That's very helpful clarity. I'll bring in Ross Greer, please.
Thank you, Convener. Just on this specific point, but a question that's been raised with me by folk who work in retail and employers who have staff working in retail environments, just on exact clarity around the requirements to be wearing a face covering in those settings. So the relevant section, I think it's paragraph 3, section D, clarifies the requirement to wear a face covering, but exemptions to that. That my reading of it essentially be for staff, as long as they're not within 2 metres of other individuals. Does this essentially mean that if staff can be on a shop floor, can be moving around a shop floor, but as long as they are not within 2 metres of a customer or of another member of staff for any prolonged period of time, that they are not required to wear a face covering?
Convener, could I suggest Rebecca White addresses that one too, because Ross Gray raises a very good point, which is raised regularly with people who see people in shops, staff in shops not wearing face coverings, and I think we need to be very clear about it.
So to answer that question, that bit of the regulation sets out some situations in which an employee or volunteer or other person effectively working for the setting doesn't have to wear a face covering, and Mr. Greer is indeed right. If a distance of 2 metres is maintained between that person and members of the public, so doesn't cover over employees, they don't have to wear a face covering. There's also additional things that might mean that you don't have to wear a face covering, so that is where there's a partition or a screen between that employee and members of the public. That also means that they're exempt from wearing a face covering. Just to add, of course, in settings where staff members are exempt, there is guidance that suggests that if they feel that they would like to wear a face covering, they are of course not prevented from wearing a face covering if they feel that would be appropriate. It's just that they're legally exempt from having to.
Okay, Ross, do you want to come back in?
Yes, thanks. Sorry, I just needed the microphone turned back on. That was very useful. Thank you, Rebecca. Just to clarify, comparing this to the situation in schools, the guidance that's been provided for school staff is relatively clear that staff should, they're strongly encouraged to wear a face covering if they're within 2 metres of pupils for more than 15 minutes. So a length of time is set out there. And obviously in most retail settings, a staff member is unlikely to be within 15 minutes of a single customer for a prolonged period of time. But is there any comparable specific guidance there? Obviously, you've got a lot of staff in retail who will be moving around the shop floor regularly and could in the space of a minute come within 2 metres of multiple customers, but only for a split second each time. These are the kind of questions I'm getting from folk who work in retail of they're not quite sure exactly what they're being told to do. Broadly, they think they're being told they don't have to wear a face covering, but they see that, for example, there's quite specific guidance, and it is guidance, not regulation, but there's specific guidance for teachers that sets out that time limit in relation to the distance, and they're just wondering if there's anything comparable for them.
There is specific retail guidance which picks up a number of issues in the regulations in more detail. I think if it would be okay with you, I can take that point away, look for the specific bit of this that covers the issue and prepare a written response.
Okay, thank you. Ross, if you have another question on a different topic, just ask it now, please.
Grant, yeah, thank you. It's still broad in the same area and actually covers the convener's point somewhat around face shields and Mr. Russell's answer to it. But the quality impact assessment notes the fact face shields are excluded from the definition of face coverings, and for sensible reasons as outlined by the Cabinet Secretary, they don't provide equivalent protection. But concerns have been raised around accessibility and ability to communicate because of the lack of availability of face coverings, so coverings over your mouth and nose that are clear. So the National Deaf Children's Society have been calling for people to wear clear face masks to facilitate communication. And I'm wondering if the government's given any consideration to advocating for the use of clear face masks in settings where people are interacting, so for example retail as well as education, and going further than that, if the government's given any consideration to supplying clear face masks, for example in education settings, so that those who work in frontline public services are able to communicate with people who have these communication barriers.
I'm very happy to consider that and to respond to the committee. I don't think there has been a consideration of whether those should be supplied, but I do recognise it. Ross Greer will know that in the guidance and the discussions in education, there has been consideration of the impact on face coverings for learners with additional support needs, for those with any level of hearing loss, for any learners who are acquiring English and rely on visual cues. All those things are in the education sphere and have been carefully considered. I've also had constituents with severe hearing problems and communication problems who've asked for exemptions to be applied, and there are exemptions in terms of communication. But whether a suitable compromise can be found through the transparent face mask, I've seen some with simply a transparent area, is worth considering again, and I'll undertake to write to the member and to the committee on it.
Okay, thank you, Ross. We'll move on to Monica Lennon, please, and after Monica, I'll bring in Ruth Maguire.
Thank you, Convener, and good morning, Cabinet Secretary. I want to pick up on the number 9 regulations about education settings in schools and the wearing of face coverings. And I represent Central Scotland, and we have had a number of cases in Lanarkshire recently involving school-aged pupils, some confirmed with COVID, who hadn't been back in the school environment and some who had. So it has raised concerns. But if I look at the guidance, you know, there's a lot of a sort of weak language, I feel. It talks about if schools wish to encourage pupils to wear face coverings, obviously they can do that, and if concerns grow about prevalence, then again that can be encouraged. But at the same time, I've had some feedback locally, and I think other colleagues have had some feedback in their regions and constituencies too, about young people feeling that they don't want to be the only one in the class or in the school who's wearing a face covering. And sadly, I read in the media this week that a constituent of mine in Hamilton had been bullied online, and his mum anonymously went to the papers to tell that story. So, you know, we've all been young. We know what it's like to want to fit in and you know, do what looks like the popular thing. So right now, it doesn't look like in the school environment wearing face coverings is popular or mainstream. So, Cabinet Secretary, can I ask if you also feel a bit nervous about the current guidelines, and rather than wait until we see more prevalence, do you think we should be doing more to mainstream and normalise the wearing of face coverings within the school environment?
Well, I think you've got to look at this in the light, as we did with face coverings in general, of the developing science and the views that exist. That happens with face coverings, and I think it's happening here. But I want to stress, and there are schools which will take this view, and quite correctly, and the guidance is clear about this too, that should the prevalence of the virus increase in any part of Scotland, and in your area there have been some evidence of increase, and in other areas that's true, then schools may wish, and I think may is permissive, but I suspect wise schools will wish to encourage the wearing of face coverings amongst adults and older young people in particular. For example, that's the approach I understand that, just to pick a school out there, Bannerman High School are taking, and it's in line with existing guidance. Now, in addition, we're keeping the issue of face coverings, as the Deputy First Minister said earlier in the week, under very close review. The advisory subgroup Tuesday, they're drawing on advice and feedback from all the partners, including in schools, to make sure that the advice is right. And they'll go on doing so, and they'll also examine the international consensus to make sure that they understand what is happening elsewhere. The current guidance, I think, is clear that face coverings are not required for most children, but those are clinically advised to wear them. You know, it is obviously essential, but there may be circumstances in which they should be advised, and schools should be advising them. Mr. Greer has referred to the distancing issue. There are other issues as well, but we also have to take account, and I mentioned this to Mr. Greer, things like those with additional support needs, those with hearing loss, those who who are acquiring English. All those things need to be carefully considered. So it's not a simple matter. I think a member would probably, criticise the Scottish Government if we were too didactic in our approach. Equally, the criticism that we're not being strong enough, I accept you have to strike a balance between the two. We're trying to do so, but we should also make it absolutely clear to any child that if they think they should be wearing a face mask, if their parent thinks they should be wearing a face mask, they should wear a face mask. And that's true of any adult in a school too. And they can't, not only can they not be stopped, but they should be quite happy to discuss that and why they want to do so.
Sorry, in the interest of time, I've got no further questions. It's come back to me, I think. So thank you, Convener.
Okay, thank you very much, Monica. Now, I think I've only got 2 members left on my list to ask questions, if they have questions. I'm going to go to Alistair Allen and then Beatrice Wishart. Alistair Allen, do you have a question?
I don't on this, Steve, no.
No? Okay. Beatrice Wishart.
Thank you, Convener. My question actually follows on from what's just been discussed in talking about face coverings in schools, but it was about face coverings on school transport. Doesn't it make sense to have face coverings on school transport? And I know it's being reviewed on an ongoing basis, but is there any conclusion after a week of schools returning?
Fair one, but obviously, as soon as there is, then members will be informed of it. But I make the same point to Beatrice Wishart that I've just made to Monica Lennon. If people think they want to wear them, if they think it's the right thing to wear them, if they think they feel safer in wearing them, they should wear them. I mean, there's no doubt about that.
Thank you.
Okay, thank you, Beatrice. I think I've got Adam Tomkins wanting to come in with a question, please.
Thank you, Convener. Good morning, Cabinet Secretary. My question is not about face coverings or face masks, and nor is it my usual question at the moment about gyms, although I still haven't had what I regard as a satisfactory answer to that. I want to ask a question about another form of exercise, if I may, Cabinet Secretary. It's about outdoor exercise. And I don't really understand. I wonder if you could explain to me, or have your officials explain to me, what exactly the rules are with regard to outdoor exercise, and in particular outdoor group exercise at the moment. Because as I understand it, and I'm not sure if this is government advice or if it's industry advice, outdoor exercise in the form of kind of boot camps and classes and so on is limited to a maximum of 4 households at any one time. But sports training for group or team sports does not appear to be limited to 4 households at any one time. I'm just wondering if I've understood that correctly. If I have understood it correctly, is it government advice or is it industry advice? Can the rationale behind it be explained? How can it be okay for group exercise to be in larger numbers when it's team sports, but still confined to a very small number of households at any one time when it comes to training camps or boot camps or the sorts of exercise that people want to do at the moment while gyms continue to be closed?
I think I should ask either Rebecca or sorry, my mind has just briefly disappeared, but we should look, Rebecca or Luke, to answer both of those. Luke will not forgive me for having forgotten his name, and I apologise. One or other should answer that, I think, in the detail that Mr. Tomkins wishes.
Okay, well, just to help broadcasting, if someone can put their hand up and volunteer, that would be very helpful. Rebecca or Luke, who's going to take this? Rebecca. Okay, just pause for a second, Rebecca. Thank you. Luke is in the huff, obviously, Cabinet Secretary.
I really feel that probably our relationship just momentary brain fade. I'm sorry.
Rebecca, please.
Yeah. In answer to Mr. Tomkins' question, the phase 3 staying safe and protecting others guidance, which is Scottish Government guidance, does set out guidance for those who are undertaking things like personal training and such like outdoors, and also for some guidance on things like sports facilities and such like. and that does set out the guidance that it should be a maximum of 4 other households apart from the personal trainer or leader of the group who are doing the sort of outdoor activity. That is because that is based on the regulations. Personal training gatherings would come under the gatherings for essentially for leisure purposes. So that's regulation, I think it's 6A of the regulations at the moment, which sets a limit of no more than 5 households for gatherings that are not otherwise specified in that list and are outdoors. Mr. Tomkins may wish to note that there is a separate gatherings provision for supervised outdoor recreation for people under 18. So that would cover, I think, team sports where the participants are under 18. The other thing that I'd want to highlight is, as far as I understand it, individual sports associations are issuing their own guidance, which sets out measures that are specific to a particular sport. So cricket, they have particular guidance about how cricket balls must be dealt with and such like. But as far as I understand it, those pieces of guidance from particular associations must set out that the household limit should be met, and so there shouldn't be a discrepancy on that front.
Okay, thank you. Adam Tomkins, do you have another question? No? Okay, that's us done. I don't see any other members wanting to come in at this stage. In that case, we will move on to item 5 on the agenda. First of all, can I ask if members are content the motions S5M 222426 and S5M 222421 are moved en bloc? If any member objects, can they please type N in the chat bar now? I don't see any objection to that, so I would now invite the Minister to move motion S5M 222426 that the COVID-19 Committee recommends that the Health Protection Coronavirus Restrictions Scotland Amendment Number 9 Regulations 2020, SSI 2020/232 be approved, and also motion S5M 222421 that the COVID-19 Committee recommends that the Health Protection Coronavirus Restrictions Scotland Amendment Number 10 Regulations 2020, SSI 2020/236 be approved. Cabinet Secretary.
Moved en bloc.
Thank you, Cabinet Secretary. Does any member wish to comment on these at this stage? If so, can they indicate in the chat box? I don't see anyone wishing to comment. Accordingly, I will put the question on the motions. The question is the motion S5M 222426 and motion S5M 222421 be agreed to. If any member disagrees, can they type N in the chat box now, please? I'm not seeing any disagreement with that, and accordingly, those motions are agreed to. We will now move on to the next agenda item, which is again consideration of subordinate legislation. And this relates to SSIs to which the Cabinet Secretary gave evidence to the committee at his meeting on the 28th of July. Are members content that motions S5M 222419, S5M 222420, S5M 2257 and S5M 2292 be moved en bloc? If any member is not content, can they please type N in the chat bar now? I'm not seeing any objection to that, and therefore I would ask the Minister to move the following motions en bloc. Firstly, that the COVID-19 Committee recommends that the Health Protection Coronavirus Restrictions Scotland Amendment Number 5 Regulations 2020, SSI 2020/190 be approved. Secondly, that the COVID-19 Committee recommends that the Health Protection Coronavirus Restrictions Scotland Amendment Number 6 Regulations 2020, SSI 2020/199 be approved. Thirdly, that the COVID-19 Committee recommends that the Health Protection Coronavirus Restrictions Scotland number 7, Regulations 2020, SSI 2020/2010 be approved. And finally, that the COVID-19 Committee recommends that the Health Protection Coronavirus Restrictions Scotland Amendment number 8, Regulations 2020, SSI 2020/211 be approved. Cabinet Secretary.
Moved en bloc.
Thank you, Cabinet Secretary. Does any member wish to comment at this stage? I don't see any members wishing to speak, and therefore I will put the motion, put the question on the motions. The question is the motions S5M 222419, S5M 222420, S5M 22257, and S5M 22292 be agreed to. If any member disagrees, if they can indicate now by typing in the chat bar. I don't see any disagreement, therefore that motion is agreed to. I think that concludes the committee consideration of secondary legislation at this meeting. Again, I thank the Cabinet Secretary for attending this committee's meeting this morning. The committee will publish a report to Parliament setting out our decision on the statutory instruments in the coming days. I see Stewart Stevenson wants to make a comment.
Thank you, Convener. I just wanted to recognise this is your last session as Convener, and to just express my entirely personal thanks for the courtesy and fairness with which you've conducted yourself. We will find plenty of things to be on the opposite side of debates in the future, but I think we've made very effective common cause in the COVID-19 committee, and I just wanted to put that on the record before you scuttle off to do other things, and we look forward to your successor in due course. Thank you, Convener.
Well, thank you very much. Stuart, I'm really rather embarrassed by that, but that's very kind of you to say so. And I was just going to say at the very end, as you preempted me, this is indeed my last meeting of the committee. I think there is a motion at decision time today to change committee membership, and I'm due to be replaced by my colleague, to thank all the team behind the committee, thank the clerks who have been excellent in supporting us in what has been sometimes very difficult, rather torturous situations, and having to deal with a large amount of detailed regulation. I'm very grateful to them for the backup. I'm also grateful to broadcasting because we managed to run all our meetings, including a stage 2, seamlessly, in my experience. So thanks to broadcasting and all the technical backup. And finally, thank all the committee members for their kindness, support and courtesy towards me. And I hope that you will treat my successor equally gently. And with that, I close the meeting. Thank you.